Good morning, everybody. I'm Freeholder Dan O'Connell, and I'd like to thank you all for joining us here this morning for a very important announcement. Let's get right to the point. The long-anticipated second wave of the coronavirus pandemic is here, and we're seeing COVID-19 spread in Burlington County and across New Jersey at a very alarming rate. During the last 2 weeks alone, our county has seen more than 2,000 new cases of the virus. That's roughly 17% of our county's 11,807 cases year to date in just 2 weeks. We're not sharing these numbers to cause a panic. We don't want people rushing out to supermarkets, emptying the shelves. We're sharing this because we need everyone to shake off the pandemic fatigue we're all feeling and get back to the mindset we had in the spring, when we all work together to slow the spread and keep our most vulnerable residents protected. Our county government is committed to doing whatever we can to help our residents manage this second wave. Back in March, we became one of the first counties to launch a COVID-19 testing program because we wanted to make sure our residents had access to this scarce resource. And with the help of the state and our testing partners, Vault Medical Services of New Jersey and the Rutgers Clinical Genomic Lab, we've been able to switch to a saliva test and greatly expand our testing capacity. We even offer a home testing option. In the last month and a half, we've tested close to 6,000 people here at our fixed site at RCBC and with our mobile testing clinics. Since the pandemic's start, we've tested more than 14,000 residents. Each one of those tests has helped us identify people who may be positive and spreading the virus, and hopefully prevent small outbreaks from growing larger. With this surge in cases and the Thanksgiving holiday next week, we know that many more people are interested in getting tested. In order to help meet demand, we're offering an extra testing day here at the RCBC site this week, tomorrow from 9 a.m. to 4 p.m. It's open to any Burlington County resident who wants to be tested, as well as non-residents who work or attend school here. Starting in December, we're hoping to continue to offer 3 testing days a week at our new test site in West Hampton at the Burlington County Human Services Building. Expanding access to testing has been a major part of our county's response, but not the only part. We have also distributed more than 2 million items of personal protective equipment to first responders and long-term care facilities, assisted school districts with COVID-19 guidance, and offered zero-interest loans to businesses impacted by the pandemic. This past week, 2 of my freeholder colleagues and myself were in Beverly helping to distribute groceries, meal trays, and lunches to hundreds of food-insecure families. We couldn't do it without great partners. Those include Governor Phil Murphy and his administration, who have assisted us with funding for our testing and other parts of our coronavirus response. I'd also like to thank our county sheriff's officers, who drive the samples taken here each testing day directly to the Rutgers lab so residents can get the results back as soon as possible. But our most important partners continue to be our residents. We're counting on all of you to buckle down, shake off the COVID fatigue, and follow the guidance of doctors and scientists to flatten the curve and get this virus under control again. We hear promising news that help may be on the way in the coming year from vaccines, but we're still a few months away, and we need your cooperation now. Together we can defeat this virus once and for all. With that, I'd like to turn it over to Dr. Conaway, our County Health Director and leader of our county's coronavirus task force. He's been a trusted voice who has helped guide our response during this pandemic. Thank you very much. Dr. Conaway?
Thank you, Freeholder. And let me say that Leadership Council, let me start first of all by saying that this is the way you wear a mask. You've got to cover your nose, you've got to cover your mouth, you've got to keep it in place when you're outside of your house, when you're at work, when you're interacting with people who are not your family. We see far too often that people are not wearing their masks properly, and that increases the risk of disease transmission. So I encourage people to wear your masks properly. Some sometimes they slip down. I even feel my gotta light it back up, get your nose covered, protect yourself from getting infection that might be transmitted to you by others, and prevent you from possibly transmitting unknowingly the virus to somebody else. So wear your mask properly to start. We're here this morning because we are seeing alarming increases in the number of positive cases in our county. And that number portends an increasing not only illness and potentially death for people who contract the virus, but it also will put our hospitals at risk from being overwhelmed taking care of coronavirus cases. Now let me say, I spoke to the hospitals this morning, and while cases are up and they have taken measures to prevent visitors from coming to the hospital at this time, there are right now plenty of ICU beds if they are needed, and plenty of space in the hospital for hospital operations to continue taking care of people in need. But the numbers don't lie. The trajectory is upward, which is why we're so pleased to see so many people here getting tested, and we're expanding our ability to test on more days of the week. We will be moving from this site, and I want to thank again the County College, Rowan College, for helping us get this quickly getting this site established. But the cold weather is coming, and so we're going to be moving to an indoor site and changing some of our procedures to make it more comfortable for those who have to who are in need of testing. And of course, as been mentioned, we will continue the home testing process. But let me just say, while I'm on that, when you order that test for home testing, please send it back. We have to spend quite a lot of staff time chasing these tests down. We pay for these tests whether you use them or not, and we want to make sure that if people request them, that they actually use them, so that the county and the state and the federal government are getting their money's worth with respect to these tests. So we want to make sure that we can continue that program. We want it to be there for those who aren't able to ride into a testing site or have other transportation issues or shut-ins. We want to be able to make sure that program continues to provide critical access to testing. We know that testing will help bend the curve on this virus. If people know their status, they can take steps to prevent transmission to others, and that is an important part of crushing this virus, which we must do if we're to get back to any sense of normalcy in our lives, in our associations with our family and friends, and for our businesses to return to normal operations where people can feel safe going to conduct various activities in commerce. So we've got to get the virus under control if we're to get our economy back online, get our jobs back online, and that means compliance with these very important directives that flow to us from the Centers for Disease Control. Those are science-based measurements, strategies that individuals can take that for all we're doing today with testing and for the vaccine that's on its way, it is individual activity, wearing masks, being careful about social gatherings, staying socially distant from people who are not members of your family. That intervention alone, which depends on personal responsibility, will have the biggest impact. For all we're doing, will have the biggest impact on the transmission rates, which we are seeing rising. In the summertime, we might see in our testing, in our own testing, we might have seen a 1% positivity rate, 2% positivity rate. We're seeing in our testing like this, we're seeing positivity rates now in the 13, 14% range. That's a remarkable increase. We're seeing that we are, while our overall regional activity is moderate, we know that Thanksgiving will be upon us in just a week or so. We know that after every one of these holidays, that the rate of transmission, the positivity rate goes up. We saw it in July with the 4th of July. We saw it after Labor Day in September. And we expect if people are not careful, to keep Thanksgiving within their nuclear family and call grandma or grandpa or children who are away on the phone or using a Zoom call. If people get together in large groups, we are going to see these transmission rates go up. We saw it after Halloween. People were having Halloween parties. We saw our transmission rate go up. So we've got Halloween, we've got Thanksgiving around the corner. We have Hanukkah and Christmas celebrations right after that. We have 4th of July right after that. And if we're not careful, we're going to have a real problem when it comes to the end of the year, when we're looking for a better 2021. let's put it that way. So I understand that people are under pressure. I understand that they are tired of having to deal with this, and they feel hard pressed. And that children are concerned about not getting, being with their friends and getting the education they want. Certainly, parents have that desire for their children to get back to work and get back to normal. But we cannot get back to normal if we don't get the virus under control. I cannot stress that enough. That means we have to take personal responsibility over what we can do. We must do what we're able to do. And we're all able to wear a mask under almost all circumstances and conditions. We are able to determine how we'll conduct our day. Are we going to go to that party that has 20 or 30 people in that house party? Are we going to have, our usual 12 or 15 over for Thanksgiving, and then Christmas, and then having a New Year's party? All of those things, I guarantee, will be places where disease activity will spread from person to person, and with the potential to overwhelm our health delivery system. So we've got to stay the course. We've got to bear down now as winter approaches, and take personal responsibility for crushing this virus. We'll do our part with the help of the federal government and the state government and our partners to make sure testing is available, that we get information into the hands of people who need it, so that they can reorder their steps to protect their own health and the health of others. We'll do our part, but the individuals have to do their part as well. Now, one last thing before I open up for questions. I want a little commercial for COVID Alert New Jersey. I'm going to say it again, COVID Alert New Jersey, COVID Alert New Jersey. This allows your cell phone. I see everybody has a cell phone. I have it on my phone. Now, as I progress through the day, if it turns out when I get tested and I'm positive, those who have COVID Alert New Jersey on their phone I can give permission for officials to send a message to anybody I've been in contact with in the last 14 days who have this device on their phone. Right now, about 5% of people in New Jersey have downloaded this and are using this platform. If we get that number up to 15-20%, it will help us dramatically with getting people early warning that they have a problem, that they may have a problem, and to get tested. And finally, let me say an important part of our strategy too is contact tracing. When someone presents us to our office as being positive, our office will call them to give them advice and instructions on what they need to do. If you test positive, you should go into social isolation for 10 days. And at the end of that 10 days, you should be 24 hours free of fever. And if those things are accomplished, then that means staying in your room at home. If you live by yourself, it's easy. But if you live with others, you should be staying in your room. You shouldn't share bathroom facilities. You shouldn't share utensils. If you're able to do that, you can protect your family members from spread. If you are a contact of someone who's positive, you ran afoul of somebody at work, or you found out that a family member is positive, you may not have symptoms, but you need to go into quarantine for 14 days. So once you hear about that, and you get instructions from the health department on this, you need 14 days of quarantine if you happen to be in contact with someone who is positive. And this is the time when people do a lot of traveling. Right now, the governor reported yesterday that 46 states are hot zone states. And so the message is we don't want you to travel because you're traveling to an area where there's a lot of disease activity. You can bring that activity home. If you travel outside the state and come back, you should quarantine yourself for 14 days before resuming normal activity. Please, please, please cooperate with our contact tracers. We're getting a lot of people who are hanging up the phone when we call, who are not helping us to contact people that they might have exposed. And that really at this time, with winter coming and the holidays coming, is unacceptable. We have to have cooperation among the public for the contact tracing effort that will help crush this virus. And use COVID Alert New Jersey. It is compliant technology that will help us